Hello, everyone. This is your just-in-time training for COVID-19, and this training is just in time, literally, because we sort of expected that the virus was going to spread to Kentucky, but we didn't know when. And as of yesterday, March the 6th, there was a confirmed case in Kentucky. So there is tons of misinformation being spread around social media regarding this virus. Now, I do want to say that this the information that I am providing now is based on what we currently know and based off of recommendations from the WHO, CDC, and multiple other organizations. But we could be wrong. However, I don't want to speculate. There's a lot of speculation going around. So I'm going to try my best to use reputable sources as to not speculate. But I do want you to know that this is a dynamic situation, and by the time you see this presentation, some of the information could be out of date, but we will provide updates as they come available. So what is COVID-19? Well, COVID-19 is a virus, and unlike DNA, it requires a host to replicate. So it needs a host cell, which could be you or your patient. Like most viruses, it is spread between animals and humans, and it is thought to have originated from a bat and spread through an intermediate host like the anteater. Now, COVID-19 is part of a family of viruses. This family of viruses can cause MERS and SARS. Fortunately, it is not currently prevalent, but COVID-19 is the one that we're currently talking about, and there are actually 7 defined coronaviruses. So a lot of people aren't wrong when they report literature from years and years and years ago saying this is not new, this is not new. Well, COVID-19 is new, and we are, in fact, concerned about it because it could have major socioeconomic implications if it continues to spread. So how is it spread? Well, we think that it's currently presumed to be spread through respiratory droplets. However, it could possibly be airborne, but that is less likely than it actually being spread through respiratory droplets. So again, droplets are the primary mode of transmission. It has a very high affinity for specific receptors within the lungs, which is why the symptoms that you see or expect to see from a patient that has been exposed to this virus are primarily respiratory symptoms. Additionally, the CDC says that patients that are exposed to this virus, the exposure generally occurs when they are less than 6 feet apart. Now, this virus originated in Wuhan. And I didn't know this. I thought Wuhan was a smaller city, but apparently it is massive with millions and millions of people, which kind of explains the large numbers of patients that have been exposed in that area and how it has exponentially increased throughout the world. Now, I'm not going to go into whether or not it is a pandemic or epidemic, but I want you to look at this map. And I looked at this map this morning, and it is being updated frequently. As of the time that I looked at this map, there were 102,471 cases confirmed throughout the world. The deaths totaled to 3,491, and I will let you decide whether you think that it is an epidemic or a pandemic. But you can see that this has obviously exponentially increased outside of China. Now, a lot of people want to say it's no different than the flu. It's no worse than the flu, or it's another flu. And that couldn't be further from the truth. When we look at diseases, we like to look at the transmittability of the disease and the fatality of the disease. And then we can determine if this disease is worse than other diseases. And one major reason that we are concerned about this disease is that it is potentially more transmittable and potentially more significantly more transmittable than your seasonal flu and even the Ebola and possibly even SARS, depending on the range. The fatality is clearly higher than that of the seasonal flu, and there is just a whole lot that we do not know about this disease yet. Now, in terms of fatality, there have been various ranges reported. Now, it is possible that the range could go up, or even more likely the range or the fatality rate could go down, because it's very possible that there are cases that have not been diagnosed or reported. So why should we be concerned, and what is all the hype about? Well, first, there is no vaccine. Secondly, there is no treatment. And when you have a new disease that is increasing at rates that this disease or virus is, and you don't have a vaccine and you don't have treatment for it, then there is certainly cause for concern, at least in certain populations in which we work. Now, vaccines are in the process of being developed, but that development could take quite some time. And again, we are concerned at the rate at which this is exponentially increasing and spreading. So the incubation period, which is the time elapsed between exposure to a pathogenic organism, a chemical or radiation, and when symptoms and signs are first transparent, is somewhere around the range of 1 to 14 days. Now, the median day is around 5 days. Patients are most contagious when presenting with symptoms. So when it comes to screening these patients, something that we need to do and something that we need to ramp up is our screening. We need to have a low threshold to obtain temperatures. In fact, we should be obtaining temperatures on the vast majority of our patients at this time, because of our concern that this virus could spread to our area. And we do not want to be caught off guard. We don't want to ramp up our temperature acquisition rate when it's too late. So fever is present in 83 to 98% of patients. Cough is present in 46 to 82%, which makes sense because this virus has a high affinity for certain receptors in the lung. 11 to 44% of patients presented with myalgia or fatigue, and 31% of patients presented with shortness of breath. Now, when you are responding to these patients with these symptoms, you should take extra precaution if they're having these symptoms alone. However, if they have recently traveled or been in contact with someone who has recently traveled, then you should implement full PPE measures. And for reasons that we don't currently know, there is significantly increasing mortality with age and in patients who have additional comorbidities. And for some reason, young and especially significantly young patients do not get this disease. It is not something, they may get the disease, but they don't present with any sort of symptoms, and there is no mortality or morbidity associated with getting this disease in the young population. Now, Benjamin Franklin said that an ounce of prevention is worth a pound of cure. We don't want to be chasing our tail on this one, so how do we prevent being exposed to this virus? Certain daily activities that you should perform on a routine starting now are a routine audit of your PPE to make sure that you have the appropriately sized and an adequate number of PPE, routine hand washing before and after caring for any patient. We want to ramp up our decon and our disinfection processes. So after caring for a patient, we want you to decontaminate and disinfect every surface, horizontal and vertical, until we know further. So thoroughly decontaminate the ambulance after patient contact. After deconning your equipment, we will also be using aerosolized disinfection. And we are in the process of ensuring that you have the proper decon and aerosolized disinfection equipment on your ambulance. Now, you won't need to use aerosolized disinfection on every single patient, but you should use it on patients who present with a high risk. Pay particular attention to every item that has come in contact with the patient. This means handles, blood pressure cuff, all monitoring equipment. But we do want you to be disinfecting all surfaces in the ambulance. And also, as of right now, you should turn on and keep on your exhaust fan on every single call. You also want to separate the patient compartment and the driver's compartment. So we are going to limit the contact with the patient for people that are not involved directly with care. Where fire would be dispatched to routinely, but it's a patient that you are unlikely to need additional assistance on, we should be asking them to leave the scene and not make entry and not make contact with the patient. So we want to try to keep additional personnel off the scene if at all possible. And as of right now, we also want to limit riders, meaning the patient's family or their friends. We don't even want them riding in the cab of the ambulance just in case they came in contact with a patient that has been exposed and they themselves have been exposed. We don't want to risk them exposing the other person that's in the cab of the ambulance. So we're going to limit riders. You need to be conducting frequent surveillance on patients, meaning temps. You also want to obtain a travel history. Have they traveled within the past few weeks, or have they been around someone that has traveled within the past 2 or 3 weeks? And what are the symptoms? Do they have undifferentiated respiratory symptoms, or do they have a cough? Do they have shortness of breath? Do they have malaise or fatigue? And when you're surveilling the patient, you can do this from the door across the room. Your across the room assessment, if the patient is awake, conscious, and talking to you, can include their travel history, their symptoms, and you can ask them, do you feel warm? Do you feel like you have a fever? If they do, then you should know that you should take full PPE measures before you make contact. Remember, the rule is 6 feet. You want to stay 6 feet away from other people until you've properly surveyed them and know what sort of PPE measures you need to take. Even when you're interacting with each other and with the community, you want to avoid handshaking. A lot of people are resorting to fist bumps or even elbow bumps. All of this needs to be noted in your patient care record specifically. ESO has just enabled surveillance for the coronavirus, so we're going to turn that feature on for you. And as administrators, we want to be able to look at the patient care record and try to identify the frequency at which we are transporting patients that are high risk. For those high risk patients, meaning a patient that has the respiratory symptoms, a fever, and a travel history, you're going to utilize full PPE, which means gloves, gown, N95, and a full face shield. Your safety glasses are not considered eye protection. In addition to ourselves utilizing full PPE, the patient needs to be masked. And when you place a mask on the patient, it can be a standard surgical mask. It doesn't have to be an N95. Our N95s are limited, and if the patient is having respiratory symptoms, N95 can severely restrict airflow, so that could make the patient's symptoms worse. We want to keep interactions with patient to a minimum if at all possible. And if we must interact with the patient, or if we must come in close contact with the patient, try to limit the number of people that get close to that patient. All students or orientees, they're not going to be in the back. We want them up front. Limit airway activities if possible, which means, let's say you have a patient that collapses from sudden cardiac arrest. They started having chest discomfort, then they went unresponsive. Well, that's not a patient that probably has suffered a cardiac arrest as a result of the coronavirus. You're still going to you're still going to conduct surveillance and ask those specific questions. But if you have a patient that, based on your surveillance of their symptoms and their travel history, potentially, even just potentially, has been exposed to this virus, you want to try to avoid endotracheal intubation, and we want you to utilize a supraglottic airway rather than endotracheal intubation. You don't want to be down there close to their face, suctioning and trying to intubate, because the longer that you are down there near their airway, the greater your chances are of contracting the virus. Now, if you have a patient that you suspect may have been exposed or currently is showing signs and symptoms of this virus, notify the receiving center early. Now, they haven't currently provided us with specific guidance on how they're handling this, but we have spoken with Dr. Hilty, and he said that we may need to wait in the ambulance until a negative pressure room is available. So if you have a high-risk patient that is transported from a home or facility, every time that we get called back to that facility or that home, we're going to be taking full PPE measures at all times. So let's say that we pick up a nursing home resident that has possibly been exposed to this virus. Every time that we enter that facility, we need to have full PPE measures if at all possible. Exposure. So what constitutes an exposure? And generally, an exposure is not if you cared for a patient with the coronavirus while wearing full PPE. I need to reiterate that. An exposure is not simply caring for a patient with the suspected coronavirus if you have on full PPE. However, if you do not have on full PPE and you transport a patient that is later to have been found out to have the coronavirus, then that is an exposure. So what are we going to do if you get exposed or potentially exposed to a patient with the coronavirus? Well, the simple answer is it depends, and the complicated answer is it depends. It depends on one, whether or not the patient was wearing a face mask, and two, it depends on what PPE you were wearing. So you can pause this video and look at this risk factor chart, which breaks down your risk factor and what exposure category you might be in. And it breaks down what specific work restrictions you would have if you were exposed and remained asymptomatic. Now, if this were to occur, you would contact your supervisor. The supervisor would then contact the chief or the deputy chief, and then we would go from there. But during the interim, after contacting the supervisor, it is of utmost importance that you avoid public contact and isolate yourself from your family until we determine what specific monitoring or guidance is needed. If you take care of a patient that potentially has the coronavirus, you will be a person under investigation. We need alerts sent to the chain of command, and we're going to review each case, including exposure, what PPE you had during contact, what kind of contact it was it highly infectious, were there significant volumes of secretions, or anything that spans a barrier. So please be sure to notify the proper chain of command when this happens. In the end, be disciplined, use common sense, keep your head on a swivel, do not allow laziness to creep in. This virus is something that could cripple our department, it could cripple our communities, and we must take it serious, because the fact of the matter is that we do not have enough information just yet. So we must assume the worst and try to prevent the transmission of this virus. Thanks.